With ICU beds running short, hospitals are trying to care for their COVID patients as efficiently as possible using everything that they have learned over the past 9 months. ABC 10 News anchor Derek Stahl is going in depth to explain the improvements in methods and medications, giving our healthcare workers a fighting chance.
Right now, hospitals just can't keep up with the surge of COVID-19 patients. And that's even more striking when you consider this. Hospitals have gotten better at treating COVID-19 patients over time and getting them out the door faster. In the beginning of the pandemic, in March, Sharp Healthcare says the average stay for a COVID-19 patient in the hospital was 12 days. As of last month, Sharp says the average stay dropped to just 5.3 days.
I think there's three big factors primarily.
Sharp Memorial Hospital Chief Medical Officer Dr. Tom Laurie says one factor has to do with better medications. COVID-19 patients now get 3 drugs: remdesivir to fight the virus, a powerful steroid called dexamethasone to prevent the immune system from going haywire, and medications like heparin to reduce blood clotting. On top of that, he says hospitals have improved techniques like when to use ventilators.
Initially, we were in this conundrum where we weren't sure whether we should intubate patients early or whether we should wait a little later. Over the last several months, we've figured out a really good progression.
That progression now starts with a surprisingly simple technique called proning. Doctors around the country discovered they could turn COVID-19 patients onto their stomachs, and it rapidly improves their breathing.
Oxygen therapy is an extremely powerful drug, if you like.
The technique has its roots in research from the 1960s by an emeritus professor at UC San Diego named John B. West. Studies have found proning can keep COVID patients off ventilators.
By putting people on their stomach in these positions and by proning them, you allow blood to get where the air is, and therefore you get better oxygenation. And it makes the oxygen levels better, it makes their work of breathing better, it makes them feel better generally.
Dr. Laurie says there are also 2 outside factors contributing to shorter hospital stays. The patients that are showing up now tend to be younger than early on in the pandemic, and that makes them more likely to respond well to treatment. And there's evidence the virus has mutated over time, possibly making it more contagious but slightly less severe. Derek Stahl, ABC 10 News.